We were supposed to have this class 2 weeks ago, but about about 3.5 weeks ago, I got a call from my mom in North Carolina. She's very sick. She had this cold congestion going on, the cough, everything. And she was caregiver, so she needed me to go take care of her. So I went, and I was still out there. I was on my way 2 days before the class was supposed to be 2 weeks ago. And so I said goodbye to my mom. We got her well. It was a really good experience. I got to practice these remedies that we're going to go over for 9 days on her. So it was good. But anyways, I was on my way back. I stopped in Tennessee to see my brother, and I started getting a sinus headache. And I knew I was coming down with what my mom had. And I knew, like, that's the time to act on it. If you just sit back and just let it settle in, it's so much harder to get rid of. But if you do these things quickly, you can ward it off. And so what I did, I made up some of the drink that I have the recipe for in here. I call it Lori's Flu Balm. I'll tell you the story about that later. But I made up some of that. I drank it. I took a hot and cold shower. I went to bed. I got up in the night. I had a horrible sinus headache. So I got back in the shower, hot, cold, some of these things that we're going to talk about. And the next day, morning, hot, cold, rested. Then I was fine after that, no more, So I knew that if I had just let it settle, then, you really have to fight it. And has anybody gotten what's going around, like the cough? My kids have had it. I've been around people that have had it. Yeah, it's not fun. And some people are taking a really long time to get over it. Yeah. So anyway, they acted quickly. And not only did they act quickly, once the patient was well, they stayed in bed for 2 to 5 days. Or they just rested. They didn't get up right away and go out because you have a high rate of relapse. There's a lot of people that think, oh, I'm feeling better, and then they go out in the cold again, and it gets worse than it was to start with. So that's the first thing they did. The second thing they did was they used hydrotherapy, which is what we're going to be talking about tonight. So I'm just going to mention it briefly here because we're going to be going over some of these treatments. I'm going to really just focus on the ones that you can easily do at home. There's some more complicated ones, but I'm going to make it simple. Okay, the third thing they did was they drank water. Water is really the best thing to drink, and especially when you're sick. You want to flush out all those toxins. They say whatever your body weight is in ounce, that's how many you half it, and that's how much you should be drinking in ounces. So if you're 100 pounds, you should drink 50 ounces a day throughout the day. So at this dormitory, they had the people drink lots of water. Fourth thing was they got them out in the sunshine. And, there's a lot to say about your vitamin D levels, and that's one reason why the sanitariums did so much better than the hospitals, was because they had the people out in the sunshine. And you go in any hospital now, you don't see the light of day. And I wanted to tell you, there's an app I found about recently. It's called D-Minder. Does anybody use it or heard of it? A friend just told me about it. It's excellent. What it does, it tells you exactly the time of day where you're at, that you can go outside and get vitamin D. So the sun has to be at a 30-degree angle in order for your body to absorb the vitamin D, for it to be the right UV rays for your body. So I think right now, according to the D-Minder, it's between like 10:30 and 2 o'clock. But it changes every day depending on the sun, and you can track your D level. It's really cool. You can take a supplement, but I really think there's something about doing it the way God intended and getting in the sun. And so this app really does help you know when to go in the sun. Okay, the fifth thing was they got them in the fresh air. And once again, that's such a difference between hospitals. I used to work in the hospital as a nurse, and they had windows that wouldn't even open. Like, there's no way to even open the window. And so there's no way of getting fresh air. You're breathing all those, rebreathing all those toxins, and just no freshness. And the last thing that they did was a simple diet. So especially when you're sick, you want to just eat light. And this particular dorm, they did use a plant-based diet. And so I want to draw a line here, because all these things, this is exactly what we need to do to prevent sickness too. That's the best thing to, is just preventing sickness. And I would add to this, to prevent, is exercise. I think, like, I've been around so many sick people for 2 months now, between my kids, just everybody, and I haven't gotten it. I think one reason is early morning exercise. There's something about going outside and like getting that you breathe so much more oxygen in a short time. And I just do 10 minutes, 10 minutes. How many of us have 10 minutes? So before breakfast, because I have 3 kids, I don't have a lot of time, but I get my boots on, coat on, and I just go, and I build up a sweat, work up a sweat, and just come right back in. And it's like, I'm almost addicted to it now. Even in the rain this morning, I was like, I've got to go outside. So anyway, this is what they did, and we can learn some lessons from them. Okay, but our focus tonight is the second one, hydrotherapy. So we're going to do some demonstrations, some things. But before we do, I want to just briefly talk about hydrotherapy. Hydrotherapy, it means water therapy, using water. We use water because it's a good conductor of heat, unlike air. If you step into a cold freezer, it's going to be cold. But if you were to take that same temperature of water and put your body in it, it would be a lot colder, because the water conducts the heat a lot differently. So has anybody used hydrotherapy? I want to hear your experiences. Okay, yes, back there. Yeah? Good. Oh, good. Yeah. Cool. Okay, so let's just talk about a couple reasons why we would use hydrotherapy, because I want to get these in your head so that when you have one of these things, you can think, oh, I should be using hydrotherapy, whichever form. So one of them is to boost your immune system. Oh, I'm writing small again, huh? I don't know. So when you heat up the body, it amps up everything, like the blood cell production, the white blood cell production, the metabolism, the circulation. So it's going to boost your immune system. The second one is increased circulation. So any type of healing, circulation increase. Sometimes, on that other list that we just did, those patients who were sick, they couldn't exercise, but you can get the same effect without, work. It's kind of passive exercise by doing hydrotherapy to get the blood moving. Leviticus 17, I think it's 4, says the life is in the blood, or 17:11, I think. So we want to get the blood to all parts of the body. I think normally only 10% of our blood goes to the surface, but when we do like a sauna or some type of hydrotherapy, we can get up to 50% of the blood to the surface of the skin. So, all right, another reason would be pain. So I'll tell you, hydrotherapy is one of the best pain relievers, and it works faster than a Tylenol, A couple weeks ago, I woke up with a horrible neck ache. I could hardly move, and I could hardly stand upright, And I don't have time to lay in bed, so what I did, I started with ice, but the next day it was even worse. And so then I just started doing the hot cold right here. Actually, Hasana came over and did one of these fomentations on me, and it was incredible relief. It was much better than any drug. It was incredible. So it's excellent for pain. Let's see. Also, I'm going to just talk about fever for a minute. A lot of people think fever, we tend to think, oh no, a fever, let me give you something to get it down. but a fever is a good thing. It's working with the body. And a lot of times when people take something to take the fever down, then the sickness will last even longer. And you don't want that. You want, because what the body's trying to do is get that temperature up, because certain organisms are killed at a higher temperature. So it's a really good thing. So you can use hydrotherapy to induce a fever when you don't have one. Like if you've got a cold and your body's not making its own fever, you can actually give your body a fever, which is going to boost it by using hydrotherapy. So you can just say give yourself a fever. Oops. However, there are certain situations where the fever is way up there and you're uncomfortable and you're miserable and you need to bring it down a little bit. You can also use hydrotherapy to do that. So, decrease fever. Another reason is for detox. We run a health retreat with Barbara O'Neill, and we're going to do a couple other ones this year. And we use the steam sauna. It's excellent detox. We have everybody get in there once a day. It gets the toxins out. If you're going through any drug withdrawals or any, you want to detox, because the skin has little pores on it, and it's like little trash cans, and you can get so much of the toxins out through your skin by hydrotherapy. And another one is sore muscles. Like if you have sore muscles, it really helps just soothe them and relax. And also for mental health. They found that people who go in saunas, it boosts the serotonin, all your feel-good hormones that come from the brain. So people that struggle with depression, they can be benefited by doing a sauna or other forms of hydrotherapy. So, okay, so the first, we're gonna go ahead and demonstrate a few different treatments. Yeah. So is there anybody, the first one we're gonna do, I'm sorry these aren't in order, but you have to just look. Mine is on the last page, but the hot foot bath, we're gonna do that first. And sometimes for other forms of hydrotherapy, like the wet sheet pack, that's what this is, you want to make sure the patient is nice and warm. And so you would give them a hot foot bath first. So that's why we're going to do that. This one is good. You can see all the uses it has, but you think any type of congestion, like congestion up here in the nose and the chest, you want to pull that down to the feet. And so a hot foot bath is going to help with any of these conditions. Cold, especially headache. I've seen it work wonders with headaches. Is there anybody that would like to have us do a hot foot bath on you? If not, we'll get one of the children. But if you want to experience it, or you're welcome. It's we just stick your feet in the hot water for about between 5 and 30 minutes, depending on what you're trying to do. Yeah. So if you want to, anybody up for it?
I'm halfway there.
Yeah. Do you want it? Okay. Good. All right. So, well, let me just say, though, there are a few conditions that you wouldn't want to do this on, and that is like diabetic neuropathy. Anybody with really poor circulation that you cannot feel the feet. Are you okay with that?
Yeah.
Okay. So.
It's actually at 100 right now.
Okay. It feels good, so we might just start with that. Yeah, so you just want to see if make sure it's not too hot. Okay. Okay. All right, so.
I just have to sit here.
Yep. Yeah, so what we're going to do is every few minutes we'll increase the temperature of the water at the feet. And what you can do, especially if you've got like sinus congestion up here, you want to keep the head cool, because that's what, cool up here, hot down here. Now we'll pull the congestion down. Okay, so yeah, I'll have, where's Hannah or Chelsea? Yeah, I'm just gonna have you guys keep checking with her every few minutes to, about like 3-4 minutes. Yeah.
I'm like, I'm rushing, so I don't know what to do.
When you, if you can go a little bit warmer, could you go a little bit warmer? Is it pretty warm right now?
Okay.
Okay, just spread your feet apart. I'm gonna pour this right between them. A little bit, just a little bit.
So typically when you do one of these treatments, you want the room to be warm and a little bit warmer than this.
And also put your hand in between them.
Yeah, I usually have her take her feet all the way out and then I pour the hot water in. Yeah.
Okay.
I've had a lot of practice on this lately. So yeah. All right. So we'll just keep you doing that. And also, what you can do with this one, you just keep the hot water in there between like 5 and 30 minutes if you're trying to, get rid of headache or congestion. But another thing that you can do is like a contrast bath. So like, let's say you've got a wrist that's hurting, maybe you got carpal tunnel or an elbow or, something, and you want to do a contrast bath. So then what we would do is get the same thing, but we would get a bucket of cold ice water. And we would do 3 minutes over there, and I'll just show you why we do this. The reason that we do hot and cold is the heat, it has a stimulating effect initially. But then after a certain time, it gets like it slows down. It's depressing. Yeah, and the cold does the same thing. So both hot and cold do this. But the difference is the time. So, when you're in cold, you go, oh, like it's very shocking. But then after an amount of time, it slows you down. That's why people die of, hypothermia and when they're in the cold. But the heat, it takes about 3 minutes. 3 minutes for the heat. And the cold takes 30 seconds. Which is why we do the hot for when you're doing a contrast bath. You do hot 3 minutes and then cold for 30 seconds. There is variations to this depending on the condition. If it's really inflamed, you might want to do a little bit more cold. But as a general rule, if you just remember 3 minutes, 30 seconds. So if you're doing a hot and cold shower, whatever it is, 3 minutes hot, 30 seconds cold. I'll take the time to talk about hot and cold shower right now. I mentioned it briefly. So when I was sick on the way, I wasn't sick, but when I was on my way here from North Carolina, I felt like I was getting sick. And I got in the shower. And so when it's like coming to my sinuses, I aim the water right here, hot. I may put the washcloth up there. Because really, it's the steam that you want to penetrate. The steam is what gets into the tissues and just really soothes. So the hot, cold, hot, cold. Some people have, maybe you have pain here in the abdomen. Then you would aim the water right here, hot, cold, hot, cold. I always get my lungs if I feel like I'm getting sick. And I'll tell you, I haven't had lung issues. I think I did get sick in the lungs one time in the last couple years, and that was because I didn't have access to a hot and cold shower. We were traveling. But anytime when I feel it coming on, I get in the hot and cold shower every couple hours, and it chases it away. So does anybody have any questions so far about the hot foot bath or has anybody tried a hot and cold shower? Yeah? Yeah. Okay. So this is something that you want to do, when you're sick or having a problem. But I'm telling you, you can do a form of it every single day, and it will help you stay well. So when you take your shower, so I go exercise, then I come in and I take my shower, take my nice hot shower, but then I end on cold. And it's stimulating, but it boosts your immune system and it helps prevent you from getting sick.
Did you specify as far as what degree or hot, how cold?
Okay,
What temperature? What should be careful?
well, the hotter and the colder you can get it, the more of an effect you're going to have. However, I've worked with people that couldn't tolerate much, so we just did a little bit of warm and just barely cooler and just a little bit of contrast.
Makes me feel like I'm having a heart attack.
Yeah. Yeah, so slow it down then. Just do it a couple degrees cooler and then a little bit hotter than you started with and then a couple degrees cooler. Because what I found is the first cold is always the worst. And then after that, you can go a little hotter, so then you're ready for cooler. And so like I went and we have a sauna over where we live. And so I did the steam sauna last night and the first cold shower. So we stay in there 15 minutes, go out to the cold shower. And that first shower is cold. But by the third one, it's like, oh, I'm ready for this, and it actually, the ice cold water feels good. So, yeah, you just got to work with what you can. And there is temperatures specified in here if you want to, try for those. But really, you just go by what you feel. And I do want to share one testimony with the contrast bath, changing. My grandmother, several years ago, when Matt and I first got married, my grandma, she got cellulitis all down her feet. And I know, I used to take care of people in the hospital like that, and we would put them on antibiotics. That's what we would do. But my grandma did not want to go to the hospital. And so we're like, well, let's try hydrotherapy. And so we got 2 big 5-gallon buckets. Do you remember, Matt? Got 2 big 5-gallon buckets, one hot, one cold, and we just went back and forth, 3 minutes, 30 seconds. And she recovered very quickly in a couple days, and we didn't have to take her in. She was so happy. Oh, in her 90s. Yeah. But she didn't have diabetes. You do have to be careful when they don't have good feeling down there. So, okay.
You start sweating yet?
Oh, yeah. Do you want?
Am I supposed to start sweating?
No, not really. It just kind of helps congestion. Would you like a cool rag up here? Do you have any congestion? Okay. Yeah, it kind of depends. Especially if they have a headache or sinus up here, I'd put cool down here to try to get that gone. But, yeah. All right, Hassana, we might, actually I was going to do the wet sheet pack next. Okay, Shemaya.
Smile, you ready?
Okay, I want to talk about the wet sheet pack just a little bit. This is the most labor intensive one that we're going to do and the most involved one. And there are definitely some cautions you need to take with this one. But I want to share a couple testimonies first. When my daughter, my 3-year-old, when she was she was like 10 months old, she got really, really sick. And we were just taking care of her around the clock. And it got to the point, it was in her lungs. She had I think maybe it was COVID, some croupy. And she was kind of having a harder time breathing unless we held her upright. And so I knew I needed to take her somewhere unless something changed. And I do not like going to the doctor unless I absolutely have to. So I'm praying, Lord, please, is there anything we can do? Because I don't want to take her. Because especially around the time with COVID, you never know what they're going to do, So anyway. So I remember telling Matt, I'm going to try one more thing, and if it doesn't work, we're taking her to the hospital. And so I did this wet sheet pack on her. And 2 hours later, she was so much improved that I knew we weren't going to have to take her. It was a miracle. So what I did with her, I didn't use a sheet. I just used cotton pajamas. Sorry. Okay, so with this treatment, I do want to tell you, you really can't do it effectively unless you have wool blankets. There's something about the wool that keeps the heat in. If you use a regular blanket, the heat is just going to go out. They're going to have a harder time just getting the heat effect that they need to get.
It absorb moisture.
Yeah.
It doesn't absorb.
Doesn't absorb moisture, and it just keeps the heat in. So with this treatment, I'm going to show you how you would do it on an adult. But I obviously, when my toddler, I didn't do this on her. I just put her in the pajamas, wet pajamas, and then I wrapped her up in a wool comforter that I had, and I just held her. And she went right to sleep because this has a calming effect. People that have insomnia, this will help relax and put you to sleep. So she went right to sleep. And there's also a friend of mine, she borrowed my wool blanket recently because her baby, same issue, and she did this treatment on her and she got the same result. It was really effective.
Is that warm to put the pajamas in, or is it better cold?
It doesn't really matter because by the time you get them on, they're going to cool so quickly that it's going to feel cold by the time you get them on. So I'm not actually going to do a wet sheet pack on him today because we're not near a shower and it's just not, but I'm just going to demonstrate how we would do it. So you want to be very careful about doing this on certain individuals though. Just in our experience, we've had better results on, younger people with good circulation. Sometimes people that are really weak, feeble, or have skin conditions, poor circulation, they won't get warm enough. Like if you sit here and shiver for 2 hours or whatever, that's not going to be helpful. What should happen is you feel cold for a few minutes, and within 15 minutes, then your body starts warming. And then if you stay in there long enough, you're actually going to have a sweating effect. So this treatment has different effects depending on how long you stay in it. So if you go to it, like the first stage is 15 minutes within that time, and then after 30 minutes, and you see the different conditions why you would use it. So my daughter, who had the bronchitis, really bad lung conditions, we left her in there 2 hours. She slept the whole time.
She was getting warm though as that.
Yeah,
As that
yeah.
thing was
Yeah.
insulated, and she was getting warmer even though it was wet. So she was not feeling cold.
Right,
Anything.
right.
She was very comfortable.
So if you do this on somebody and they're just not warming up, that's not good. So I wouldn't leave them in here for 2 hours if they're still cold. All right, so I'm gonna have so what I would do is wet this, wring it out real good. I have this little hydrotherapy kit. It came with this. You can use, like, if you want to protect the bed, you can put like a shower curtain down or something. And then I have these wool blankets. Now, wool blankets are kind of hard to find, but these I actually just ordered off of Temu. They were only like $20. And so I think it's a really good thing to have on hand for just anything like this. Because in the past, I know they've been really hard to find. So I'm going to have you lay up here. So I would wring this out, lay the sheet down, and then he would wear as little clothes as possible. So if he's, yeah. So if he's, but first, before I do this, I would give him a hot foot bath. So after he's done this, a hot foot bath, yeah, to get him warm. You want the body to be warm before you try this, okay? All right. So yeah, you want to do this really quickly because they're going to be cold. Okay, so lift your arms up and spread your legs a little bit. Okay, so the first one you put, you wrap it here, and then you bring it back over here around the other leg and put your arms in now. Okay. Oops, it's stuck. Okay, yeah. And then you wrap them up really good. I would probably have this down a little more. And I would probably at home, I would probably use more blankets than this even, but I didn't want to haul more stuff over here. So, and then it's really important to keep the feet warm. So if you have a heating pad or hot water bottle, you want the feet to stay warm the whole treatment. And then you can put a towel here to make sure the air doesn't escape. And yeah, that's really all there is to it. You ask him, are you warm enough? You might pile another blanket or two on until he gets warm, and then you can kind of go from there. And yeah, that's it.
I have a question, Lori.
Uh-huh.
I read that you should be wearing cotton now for the breathable. That's what the hospitals used to do.
Yeah.
Is that what you recommend for them in the blanket or nothing?
Yeah, thank you for mentioning that. Yeah, you definitely, so he should not have any clothes on, really.
Okay.
But if, let me open up here. Okay, so instead of the sheet, like if I had a toddler and I was going to put her to bed or something, I don't know, I just used 100% cotton pajamas. Instead, you want a cotton sheet. Make sure you have a cotton sheet. Otherwise, you can use pajamas and just do it that way. I also want to tell you this wet sheet pack, right now we're doing it to the whole body. I think we're done, Shemaya. Thank you. But you can do it a little more localized on different areas. The other areas, well, 3, that people do it, sometimes around the abdomen you can do it, but on the feet or the throat. So let me show you. You just get like a cotton, sometimes I used to cut up old t-shirts or whatever, and you wet this, or old sheet, you wet it and wring it out, and then you would put it on your throat. And you can put like a little piece of plastic over just to keep the water in. And then if you have a wool sock or some sort of piece of wool, you can tie around here. And even as a little girl, my mom used to do that for me anytime I got a sore throat. And I remember I'd wake up in the morning and my throat was never sore. So it does work. You can also do it on your feet. You can wet a cotton sock if you have one, and then put like a wool thick sock on over it. And sometimes people that have insomnia, hard time relaxing, that's really good to put on your feet because it kind of draws, people can't sleep because there's too much activity up here. You got to draw the blood down, and that helps people relax. So okay. It depends on why you're doing it. If I was going to reduce a fever and that was my only purpose, probably 15 minutes would be long enough to do that. Okay, so when I was at my mom's, we did do this on her, and she maybe got some benefit. She didn't seem like she really warmed up that much either, but she said she felt a lot better afterwards. So, however, the treatment that we're going to show you next is what helped her the most, and it was like, after we did that, she's like, yeah, let's do this 3 times a day. And it brought so much relief to her. So Hassana's going to help with that. But before we do that, we're going to end her hot foot bath. And so what you want to do is just pour cool water over between 55 and 70 degrees. Wait a second, let's get a towel. So,
I'm gonna have you just lift up.
yeah, there you go.
Go ahead and put it and just set it down. You don't want to get your pants wet, so we won't go too far.
So just cool her off. So you always end hydrotherapy treatment. Yeah, do you want to do it so I can talk? Thank you. You always want to end on cold because it closes the pores and equalizes the circulation. That's probably, yeah. All right, so the next one we're going to do is very similar to a contrast bath. So back to the contrast bath, like you can also get 2 big tubs. Like let's say you've got something going on in your pelvis, you can get maybe go to the store and find tubs big enough to sit in, just from here to here. And if you have 2 tubs, you can do a contrast bath, like for like a UTI, for any abdominal problems or like uterine or stuff like that. So people do that. But what we're gonna do, the hot fomentations, it's very similar to the contrast bath, except we're going to use like fomentations or rags. I have, when I went, my mom actually purchased a hydrotherapy kit somewhere, and so these are some fomentations that they had made, and these are really thick, heavy ones. There's different ways you can do it. One of them is you can boil the water and put this in it and wring it out and put it on there. You have to be really careful not to burn yourself, obviously. Another thing, you can, I've never done this, so I don't really have any experience, but there are ways to do it in the oven. But by far, the easiest way is if you have a microwave. It's so easy. So we're going to have Hassana do it in the microwave. Okay, so she's going to do hot water, but we will show you how easy it is to do in the microwave because it's so easy that, you know, now you won't have an excuse not to do this.
We're gonna do the microwave because you can steam or put it in hot water, boiling hot water, or microwave. All you do is, so I got this one, but you can use a regular towel. Can use a oh, it's the same. Wait a minute now. Okay, you can use a same towel, maybe smaller than this, but, and do it like, let me see, like this. See that, halfway, and then like that, and it will go like this. And that way it covers where the sinus is in, here and here. And it feels good on the eyes too. Oh, it's so good. Even just stress, when you have stress, you know, that happens, you can take a cold cloth and just put it over your face. Oh, it feels so good. You know, cold treatment does help with nice glowing skin. So cold showers, really good, or ending up with cold. So that's cold. Okay, thank you. So I wring this out, and I put it in a Walmart bag. Aren't we thankful for Walmart bags? So many uses. I mean, huh? Oh, that's Kroger. Kroger, Walmart. And yeah, they're so handy. I use them a lot. And then we're gonna put it, we have a microwave over there, and we're gonna put it about, I don't want to burn him, so let's try 20 seconds. So it needs a little bit wet, and then put it in there. And then especially when, so that's the easy method that way. And it's good when you have two people doing it. Now, when I did it on Lori, when I did a fermentation on her neck, I did have to go back and forth. And I had some, also you need a cold cloth. We have it here in cold water, but you can put a cold washcloth in the freezer, 2 of them, so you can alternate. You don't have to go and wring it. You just go to the freezer, put it in there, put it back, get the hot one, put it on there or on the, whatever you do fermentation. Oh, this is good. Okay, good. Oh, you put some in there, good. So this one I'm gonna apply right on him like that. I'm not gonna put a barrier down, another towel there. You can when you do fermentation on other areas, but if the person can tolerate it just on the skin like that without another towel between the skin and this, then that's okay too. Okay, Shemaya, I'm gonna do this on you. If you can go a little bit this way. And let me, so does that feel okay? I'm gonna do it like, is that okay?
Yeah.
Is that hot? Is that too hot?
No.
No? Okay, so about 3 minutes and about 30 seconds with the cold. So yeah, we just leave it in there. And so a couple of things I want to mention. With the garlic, you have to be careful when you put it under your feet sometimes, because I heard of stories that it can burn a hole in under your feet. So I don't know if it makes a difference if it's first steamed or something. Maybe it's less.
I mix it with oil.
With oil, and that helps.
Petroleum jelly or something.
Okay.
Yeah, not,
Okay.
not straight. Yeah, castor oil.
Okay. And another thing about the wet and hot, what it does is you're tricking the body to make more white blood cells. So whenever you're fighting infection, white blood cells come to rescue, right? The fighter cells. But when you do hot and cold, you're increasing it. Like, because the heat, the cold contracts, the heat expands. So you're doing a pumping, like that blood, the nutrients, the blood, oxygen comes to the area. And what happens is you're tricking the body to make also the white blood cells. And you need those fighter cells. Yeah, nice.
Oh, he looks better.
It's clean now. Okay, thank you so much. And back cold. And you do this like 3-4 times, you know? So this is just, okay, again, whenever you do it on somebody, ask them if they can tolerate that. If not, just doing this, it cools it down some. The air with hitting it, it cools it down. There we go. That always end up with cold, or it's not a complete treatment like Lori said.
The reason they recommend doing 3 cycles is because you don't want to wear the body out too much. It's really pulls the blood. It can be exhausting. So it would be better to do a treatment of 3 cycles every couple hours, like if you're in a lot of pain or something, rather than doing too many cycles. So now we're going to just share a few other remedies that we use if we come down with colds or flus. I do want Delbert to come up now, though. Is that okay? Because about a year ago, he got sick and we used some of these treatments. So I just wanted him to share his testimony a little bit about how that went.
Actually, I've been involved with this since I was a little kid. A lot of these therapies my parents used to do on me. And then when you get older, you forget what you've taught. Anyway, so last year I came feeling sick, and I didn't do like Lori said to take care of it right away. And anyway, I got sick, and my wife was there. Now, I believe in home remedies, right? But if I don't get better in a few days, then I end up taking drugs. And I realized that's not really God's method. So last year, we went ahead and did the full gamut. And I don't know what I had for sure, but it was somewhere with a severe case of COVID or pneumonia. Anyway, my wife did hot fomentations on me, at least 3 a day. She would basically start on something about 7:30 in the morning, and she worked till 8 or 9 at night. Of course, in the meantime, she's cleaning up and doing this and doing that and getting warm soup or whatever it was. And I stuck with it. She stuck with it. And I actually got over it. And I believe it was pneumonia. And of course, people that check with physicians or people in medical field say, go to the hospital, go get antibiotics. But I had no antibiotics. And it was, in my mind, it was the Lord healing me. And sometimes, when we do drugs, I don't know if we're all aware of this, but when we do drugs, we're actually not allowing our bodies to heal itself, is God's remedy. And sometimes then your body has to, if you give it the opportunity, it takes time later to heal itself. And sometimes it's more dramatic and longer than if you'd have just let it do it the first time around. So I believe that a lot of those times that I hadn't allowed my body to heal itself and tried to cover it up with drugs, that at that time last year I was getting recovered because of those other times. So actually I'm very happy that the Lord used my wife to help me get better in these remedies. So it's nice to have a spouse, a wife that is willing to put out the effort, because it can be a lot of work.
What Hassana just did on his sinuses, you can do on your chest. So like when I was taking care of my mom just a couple weeks ago, we would do this part, and then we would do her chest the same way. But you can have them laying in bed and do the fomentations that way. And I think, Delbert, you didn't use the microwave. Did she boil the water and do the fomentations that way? Thermofor. Okay. The other way you can do it is with one of these. This is a special type of heating pad called a thermofor. And what's different about it is that it's got moist heat, because it's really the steam that you want. You don't want a dry heat. You want the moist heat. So if you can invest in one of these, it's well worth it. Yeah, because you just put it there. It's a lot easier than dealing with water. I'm not sure if it's quite as effective, but it sure is easier.
You have to wetten that?
No, this one you don't wet. It's got the moist heat in it.
A friend of mine had given me some information on how to help people with the respiratory issues using a nebulizer. But nebulizers are pretty easy to use. Does anybody have a nebulizer? Ever used a nebulizer? Couple. So they're similar to what you're going to get if you have like an inhaler, right? Except an inhaler is a single shot of usually like your medication for a respiratory issue. Basically, what this does is it forces air through whatever liquid you put in here, whether it's your asthma medication or whether it's something natural that you're able to, use for something that's chronic that you have or something like, a respiratory illness. And so, like on the paper here, it kind of shows you, like, let's see, under the Argentine 23 silver, that's colloidal silver. That's the second, highlight there in that list. 3 mils is going to give you about 10 minutes, roughly, 10 minutes of nebulizing, and you can do that, give or take, 4 times a day. You could do 4 times a day, or every 3 hours while awake, maybe even through the night. If you get up, or if you're taking care of somebody and you get up or they get up, if they're really sick, you're going to want to set an alarm to do some of these, therapies, any of these therapies. And what this does is it basically turns whatever you're putting in here, like I said, any number of things, into ultrasonic, vapor, thank you. And so that your body can take it into the smallest cells. And that's why it's so effective on your lungs. Let me just demonstrate really quick. It's pretty simple. This cord really never gets anything in it. If you're needing to kind of help between people, use a mouthpiece on mom, use a different mouthpiece on dad, use another mouthpiece on sister, but you don't have to change this every time. There's the hole, that's where your air comes out. This just, clips onto that real nice and tight, or onto this. So the layout's really pretty much the same. There's a little spot here. This is just a filter. If I was using it a lot, or if I saw darkness in the filter, that unscrews. Same on this one. This little thing pops off. I just made a little bit of a saline solution here, and it's 1 teaspoon of non-iodized salt with 1 cup of distilled or boiled water. You just want to make sure that what you're using isn't going to have any extra contamination from, because you're taking it right into your lungs. You're breathing it. So 1/2 teaspoon of non-iodized salt with 1 cup of distilled or boiled water. And you want it to dissolve. So you might warm that water up a little bit. You could certainly boil some water on your stove, add your salt, and then let it come to a comfortable temperature. I'm just going to put a little bit in mine. All of these open a little bit different, but they come with instructions and they're pretty easy to follow. So I have a little bit of saline here that I did. I'm just going to put a little bit right down in here so that you can kind of see the steam. So what you want to do is when you're taking this, you're going to breathe through your mouth, right? So I'm going to put my mouth on here. You're going to breathe through your mouth and then out through your nose, So let me just turn this on. Okay, see? It's shoving it right into my mouth. You don't have to breathe deep every time like you're going to get lightheaded, but just remember several times to just take a nice big opening breath. This is the adult mask. I don't think I have any children's masks at home, but if you have a child or somebody again that's really sick and you're not sure that they can comprehend the, in through the mouth, out through the nose, keep your mouth shut, do all that, then you can put this on them. It's going to, whether they breathe through their nose or their mouth, they're going to take this in. There's vent holes where the air can escape when they're doing their out breath. But this one you can't really do sideways because you can't adjust it sideways. That has to stay up and down, the little cap. And so this one's a little bit harder to use if you have somebody that's sick in bed. A pulse ox is one more just important thing to have, especially with respiratory. If you don't have one of these, it's well worth the $6 to $10 that they are. If you have your O2 saturation, you want it to be 92 to 100. I'm at 99 right now because I'm doing a lot of talking and breathing. And my pulse is 89 because I'm excited. 103, 105. Well, this is just helping you know what your oxygen level is. Like when Delbert was really sick, his oxygen level was probably pretty low. That's what starts to get scary when you can't breathe very well. Like he said, he thought he probably had pneumonia. This is going to help. You know, I think you just want to be sure, again, just use your judgment. You're taking something straight into your lungs. You don't want there to be any or much contamination.
So this is colloidal silver. I made that today. But I have a kit too, and I'm going to show you how to set that up too. But a little bit about colloidal silver. Colloidal silver is antifungal, antibacterial, and antiviral. And it started, well, I think way before that, but I have a story a little bit about a little history. Like in World War II, they used to use that on soldiers, but it was not like this. It was like silver ground up and put in a solution, and they had to inject it into you. So we have come far along what it is now. And it is believed to, at that time, to have actually cured over 600 different diseases. And that is with just colloidal silver. There was one problem at that time because it cost like $400. At that time, it was not the money like it is now. You know, that was for the rich. So only the rich could afford it. Have you heard the saying, born with a silver spoon in your mouth? Because fewer of the wealthy died from the plague, silverware and silver pacifiers were still given to babies in many countries. In the United States, people have forgotten that heritage and use plastic pacifiers today. American settlers knew the value of silver both as wealth and for their health. They often put silver dollars in milk to keep it from spoiling. During the 14th century, about 25% of the people in Europe died from the bubonic plague, which swept through the continent. Wealthy people gave their children silver spoons to suck on to forestall the plague. That's why it's called silverware. So in 1884, Dr. K.S. Creed, a German obstetrician, discovered that a mild silver solution put into a baby's eyes at birth dramatically reduced eye infections, which were common in babies. Shortly thereafter, laws were created in the United States, Canada, Norway, and Denmark, requiring all physicians and hospitals to put a silver solution in the eyes of every baby that was born. It is still done today in most countries. And then you had Dr. Jerome Alexander. There's a book, he wrote a book called Colloid Chemistry. Said that he tested the concept and found that silver ions were rubbed off the metal and did indeed destroy harmful bacteria. His storage texts show that serious medical study of colloidal silver began in the late 1880s, with it being used to successfully treat typhoid and anthrax bacterial infections. And then you have Dr. Henry Crookes is credited for the wide use of silver in the early 1900s. He used it for subduing gonorrhea. I think it's STD, maybe? Gonorrhea, yeah. Tuberculosis and staphylococcus. I should have learned to pronounce this at home, as well as many other infectious organisms. His scientific reports concluded that there was no known microbe that could not be killed in the laboratory with colloidal silver within 6 months. The naturalhealthlibrary.com. This man has over 30 years of experience with colloidal silver, with iodine, colloidalsilverhowto.com. And I think this man is in Arkansas. I bought this kit from him, this one here. Somebody found out how to do it with these. Just this is 24 volt, and you get this silver. So I bought this silver. You can buy it also from both websites. The website I gave you, the naturalhealthlibrary.com, and you can get it also from colloidalsilverhowto.com. Yeah, this is 0.9999 pure silver. Okay, this is. And I got this from colloidalsilverhowto.com. They are local in Arkansas. It does come with agitator. I found out that it's good to have agitator. You get more pure silver. So he made this cap, and it goes through here. And you don't want it like right here. You want it down some like that. You put water that's distilled, okay? So you fill it with distilled water. The agitator, this bubbles, keeps the water moving. And this goes through these two holes, small holes. Oh. So you want to make sure that it doesn't rub against the glass, that it's right there. And then you plug this in. Orally, 20 parts per million is good. And so then you have a laser. I don't have it with me. But after about an hour, I check it. And with a red laser, you can get it at Dollar Tree. You go to an enclosed closet in the dark, and you put it through it and see if you see the red line in there. And that means you have produced colloid. So that colloid, it's now colloidal silver. And when you taste it, you taste a little bit of metallic taste. That means you have colloidal silver now. With this one, it comes with instructions, like they will say, how many parts per million does it make per hour? Like if it's 1 hour, it makes 20. When it's 4 hours, and it will tell you with the instructions. So you can kind of keep an eye how long it needs to be brewing. And then you can, he said, even Coke bottles, you can store them in, tinted or clear. But if it's clear, put it out of sunlight, out of light. Not glass, because over time, if you put it in glass, the colloidal silver, it will stick to the glass, and you will have less in your water. So asthma, I used it on eye infections on people. I use it like what Chelsea just did with nebulizer. Oh, it's so good for asthma symptoms. I mean, you feel so relieved, like within a few minutes, you feel just relieved. Eye infections. What else? Oh, staph infection. I used it somebody on staph infection. The kid just fell and ruptured, just a small rupture, like less than a half an inch. Just a little, but I saw that it was getting a little pus, and there was a red ring around it. I was like, that looks like infection. And but anyhow, it took care of it. And
Okay, we're just wrapping up here. I have one more thing I do want to mention, though, because this is just my go-to anytime I get sick. And I want to tell you, like this Lori's flu bomb recipe, I want to tell you how I ended up doing this. Because Barbara O'Neill also has a flu bomb. It's not quite as strong, but it's effective. But about 15 years ago, when my husband and I, we weren't married yet, we just started dating, and I got really sick. And I'm pretty sure I had walking pneumonia. It was really bad. And I was the same back then. I didn't like to go to doctors, but I was getting to the point I've got to go. So, but I was praying about it. Lord, is there anything I can do? And I was actually sitting in front of the emergency room in the car when I got a phone call. And it was a longtime old friend that happened to be a natural doctor. And I told her, I'm sitting in front of the ER about to go in. You called just in time. What do I do? And she said, go get a bulb of garlic and a bunch of lemons, blend them up, and drink the whole thing. I was like, are you serious? And, Matt and I always just started dating. So he went and got the stuff for me. And We spent we crushed up all the, yeah. So that's a lot of garlic. So about this size, not just a clove, but about 10 to 12 cloves, the whole bulb, And so depending on what size bulb you get, it's going to be different strengths. Now, I've read that, I've heard that 3 bulbs is 6 times stronger than the antibiotic tetracycline. So here's our antibiotic right here. So when I'm sick, I try to take this at least 2 to 3 times a day. So this is kind of the recipe that I've been making lately. And, there's just times when, I don't know if you guys have this, but I just can't be sick. Like maybe there's something going on the next day or two, and it's just like, I cannot be sick. So this is what I do. I blend up, and depending on how determined I am, I will drink the whole thing in one sitting, and then I'll make it again a few hours later and drink it, and I'll tell you, I can ward off anything, doing this. Even that, yeah. So anyway, I'll tell you, I kind of think it tastes the best if you just do garlic, lemon, and a little honey and stevia. I think it has the best flavor. But these other things are, like the ginger helps if you have any issue with nausea. It's going to help. And the eucalyptus oil, cayenne, optional. Yes, Glenn?
Upsetting your stomach.
Okay, here's the thing. When you blend it with lemon, it does something to it, and I don't know what. Because if I chop up a raw garlic and I take it, it burns. But so when I make it, I didn't want to bring my blender and all that out here tonight, but I always do the garlic, smash it up, put them in there, and do 1 cup of lemon juice, and I blend that. Because I've tried it where I did water, and then added the lemon juice later, and I don't know what happened, but it was so spicy nobody could tolerate it. So something about blending the lemon with the garlic, it makes it better. Yeah, and usually even my kids love it, and even my 3-year-old, she'll drink it. So I did blend some of this up. However, I don't know what happened to this batch. It's stronger than normal because my 3-year-old just had some. She's like, that's too spicy. So just so you know, if you want to try some of this, you're welcome. But just know that it normally is better. I don't know. I did run out of stevia. That might be it. Or maybe this is just a little bit stronger garlic. Garlic can vary. So you might want to, just try half of this, see how it goes. All right, and just note that garlic, this is a lot of garlic. If you're on blood pressure medications, this will lower your blood pressure. So just be aware of that. It also thins your blood. Okay, so when my mom was sick, she would drink one of this for 1 day. So she drank 1 of these per day. So she would divide it into 3. She'd save some for the middle of the night so that she would just get up and then I would make her a fresh one in the morning. And so throughout 1 day, she had 1 of these. I'm a little bit more I don't know what the word is, but
More is better.
yeah, more is better. So I usually drink the whole thing at once, but that's just me.
So you
So.
drink 3 of those a day?
I don't think I've ever drank 3, but I've definitely drank 2 a day. So, yeah. But, just use caution and wisdom, and it is a lot of lemon juice. This is actually pretty similar to Barbara's liver cleanse recipe, if you've looked at that. Just a few different, but it's got the cup of lemon juice and the ginger, similar, and just more garlic. So. And last, just real briefly, vitamin C, we all know it's good for us when we're sick. I just want to mention, I really love this brand. It's Camu powder. Camu is one of the highest sources of natural vitamin C. I'm all about using the kind that God made rather than the synthetic kind that I think your body has a hard time recognizing that. And this has 1,000 milligrams per serving, which is the highest that I've found. And just a real quick testimony, my 3-year-old had a fever several months ago, and I gave her a glass of this, and she said, I want more, Mommy. I do put a couple drops of stevia in it, and it's good. It's not bad. And so she's like, I want more. So I gave her another one. few minutes later, can I have more? I want more. I want more. And so she's so sick. She's been on the couch as a vegetable like all day. So it's like, okay. So I gave her another one. And literally like a few minutes later, she's like, I feel better. And she got up and, will you play with me? So I just saw such a difference like right after I gave her a bunch of this. So I just wanted to mention that. And I think that, we didn't really go into herbs. There's so many different herbs that we could have talked about, but these are just some remedies that we can do. All right, if there's not anything else, yeah, let's just close with prayer and we'll be done. Dear Father, once again, I just thank you for these simple treatments that you've given us, and I pray that we'll continue to learn and know more about how we can take care of our bodies and share this information with those around us. So we know sickness is everywhere, Lord, and we just ask that you'll help use us, and please keep everybody safe on their way home tonight. In Jesus' name, amen.